Alright, this is the fifth in a series of recordings for the reproductive system anatomy, and here I'm talking about the vasculature and the lymphatic drainage. So we talked a lot about the organs of the pelvis, but not the actual blood supply, so we'll focus on that here. Blood supply to the pelvis, internal iliac artery, done. Okay, now, internal iliac artery, you can see indicated by that blue line, can be divided into a posterior division and an anterior division. The posterior division we're not going to worry too much about because most of it's going to the gluteal region via the superior and inferior gluteal artery, and so you've already done that, don't worry about it. There's one branch that we will focus on, anterior division. So we'll start with the female. Anterior division is where you're going to get all the blood supply to the pelvic structures. First of all, the umbilical artery. Umbilical artery embryologically is that same artery that's carrying deoxygenated blood. Now it's carrying oxygenated blood, and it's carrying and its major supply, or the major branches, is the superior vesical arteries, and they're supplying the bladder. All right. The distal portion of the umbilical artery actually is going to close off, again, because it's not going to go off to the placenta anymore, so it closes off and it becomes the medial umbilical ligament. All right, so that's the umbilical artery. Next artery off this division, the anterior division of the internal iliac, is the obturator artery. Doesn't supply the pelvis, but it's found within the pelvis, and it's exiting through that obturator canal down into the medial thigh. All right, next major branch, uterine artery. Okay, obviously going to the uterus. Distally, it has a branch, the vaginal artery branch, which is going to the vagina. All right, next major branch is the internal pudendal artery. Okay, internal pudendal artery is running with the pudendal nerve, so it has that same course, that meandering course where it exits the pelvis through the greater sciatic foramen and then re-enters the pelvis through the lesser sciatic foramen, then runs in the internal the pudendal canal to go to the perineal structures. All right. And then that one lonely branch off of the posterior division of the internal iliac is the lateral sacral, and it's just supplying the posterior aspect of the body wall in the pelvis. And you can see that its course there. All right, in males, exactly the same, except, of course, because there is no uterus and vagina, there's no uterine and vaginal artery. Instead, off of the internal pudendal artery, there's a major branch called the inferior vesical artery. It's going, obviously, to the inferior aspect of the bladder, but one of its major branches is the the prostatic branch of the inferior vesical artery, which is going to the prostate gland. So that's a really important branch. All the other branches are the same. All right, so you can look at it, you can categorize things a little bit to organize it in your mind. There are visceral branches going to the pelvic organs. There's the perineal branch, which is going to the perineal region. That's the internal pudendal. And then you have a somatic branch, and in this case it's just one, the lateral sacral. All right, so that's the arterial organization. Pelvic, venous drainage, same as the arteries. Okay, so that's the simple version. All right, some exceptions. First of all, the testes and ovaries. Not drained into the internal iliac, they are going directly to the IVC. Now there is an exception, of course. The right is going directly to the IVC, but the left testicular ovarian vein is draining first to the left renal vein and then off to the IVC. All right. Some venous plexuses are like a collection or a network of veins. All right. In the females, pampiniform venous plexus, you can see it in this diagram adjacent to the ovary. Ultimately, that plexus of veins is going to unite to form the ovarian vein. Right? In males, there is a pampiniform venous plexus which is found in the spermatic cord, which ultimately is going to form the testicular vein. In females, you have the uterovaginal plexus. Okay? Again, of course, surrounding the uterus and vagina, ultimately going to form the vaginal vein and the uterine vein to drain off. All of these plexuses within the female are interconnected, so there's an anastomosis between them. In males, prostatic venous plexus, so that's a plexus of veins surrounding the prostate gland, and it's found within that dense capsule of the prostate gland. It has an important anastomosis with the vertebral venous plexus. Okay, so the quite a ways away, there's this anastomosis with the vertebral venous plexus, and that has important clinical implications. All right, so that's venous drainage. Lymphatics, I just want you to know the basic flow of lymphatic fluid, and that's highlighted at the top. Okay, so sacral, and then to the periaortic, and the lumbar, and those are all listed in the figure on the next slide. All right, so now what you do is just take a look at these organs and where's their primary site of lymphatic flow, and then you can follow the basic flow of fluid after that. All right, so this is for the female, and in the female you can see in this diagram, I definitely don't want you to know how, like, the specific color coordination. What I've said in the previous slide is as accurate as you need to know. And here it is for the male. All right, so that's blood supply and lymphatic drainage to the pelvis.